Today, I'll share the key facts you need to know about blood clots and thrombosis. Watch this video until the end and you'll learn how to act in situations when you have a blood clot, how to recognize it properly, and how to save your life. When will this happen? Why did I record this video? Probably the most common cause of death in the postoperative period for all patients in surgical hospitals is thromboembolism. What is thromboembolism? Thromboembolism is the detachment of a blood clot, which most often forms in the large diameter veins of the lower limbs, or from the pelvis, and its movement with the blood flow to our heart and then into the pulmonary artery. If the clot is large enough, it leads to a fatal outcome. You have no time to think or feel, you just lose consciousness. And even if this happens in an intensive care unit, very often it's not possible to save the person. That's why it's extremely important to detect thrombosis at early stages and do everything possible to prevent blood clots. And today I'll tell you about it, so give a like and listen to what you need to know about blood clots. Many think blood clots are always bad, but that's not always true. There are conditions when a person physically either cannot form blood clots or does it poorly. Then any blow or injury causes extensive hematomas. Because even the slightest bruises you see on the body, why don't they spread into huge pools? These small vessels form clots, meaning it's a physiological process that prevents you from dying of bleeding. For example, patients who have a heart problem are prescribed medications that thin the blood and prevent clots from forming and sticking together properly. Operating on them is nearly impossible. If such a patient ends up on the operating table in an emergency, they bleed from every incision, from every injection, and that's probably a surgeon's worst nightmare. That's why the most important thing is to have a sober attitude toward thrombosis. And today, let's take a look at what a thrombus is. It's a clot conventionally made up of fibrin and platelets that blocks the vessel's lumen. It often forms in a place where the endothelium of the vessels is damaged, meaning the healthy endothelium of the vessels. The endothelium is the inner part of the vessel, and basically a thrombus shouldn't stick to it. That's why people who have, for example, a mural aneurysm or a dissecting plaque have a higher risk of thrombosis. But if we look at today's world, at today's youth, at you, at me, what risk factors are present in each of them? Here we have coffee, dehydration, smoking, hookahs, electronic cigarettes. All of these are risk factors. But let's focus on the key ones. What you need to remember is that if any of these are present in your life, then if you experience any strange symptoms, which I'll talk about, you shouldn't rule out thrombosis. First, your risk of thrombosis increases significantly if you are a chronic smoker, if you are a heavy smoker. That includes e-cigarettes, hookahs, and cigarettes. The second important factor that often contributes to thrombosis is women taking oral contraceptives. COCs, or oral contraceptives, greatly raise the risk of thrombosis. The third factor is flights, long flights. Have you noticed how your legs swell during flights? Have you noticed how you swell yourself? What do you think, where does this water come from? That's right, you squeeze it out of your blood vessels, meaning you become dehydrated. And now look, you smoked, and God forbid you also took oral contraceptives. And you are flying for about 6-7 hours in a sitting position without getting up. Your blood isn't circulating in your lower limbs, and naturally the risk of blood clots increases significantly. Usually nothing happens on the plane or in the hours that follow. But it happens when this clot breaks off. Very often people die after long flights, 3, 4, 5, or sometimes even 10, 12 days later. A clot is safe as long as it stays in place. If there are additional drainage pathways, you might not even feel it. One of the symptoms of thrombosis, especially if it's a large vein, is sometimes localized pain. Sometimes if inflammation develops and thrombophlebitis occurs, there can be a change in local temperature. Sometimes if it develops. And this, by the way, is one of the most dangerous manifestations. In the size of one of the limbs. That is, if you just swelled up because you ate something salty or drank some water, your whole body swells up. But if you suddenly notice that one of your legs is swollen twice as much as the other, you should consider whether there might be blood clots there. Why did I even decide to talk about blood clots from coronavirus? This year, many patients have died or had post-surgery complications from thrombosis, affecting several of my colleagues. If someone recently had or currently has coronavirus, their risk of thrombosis is very high. And we all talk about blood clots in the lungs, but these clots are not as dangerous as the clots that appear due to changes in blood rheology because of autoimmune thrombosis of autoimmune origin, the formation of clots in the legs. How do we deal with this in general? What should we do about it? In other words, how do we eliminate the main factors? Well, let's figure it out. Naturally, if you smoke, the simplest way is to quit smoking. Quit smoking hookah, electronic cigarettes, and regular cigarettes. If you're dehydrated, consider an airplane as an example. Of course, I do the same, no matter who laughs at me, even though I'm not that old. I have compression socks and stockings, but stockings aren't as comfortable. I tossed the socks in my backpack before the flight, wore them, sat somewhere, sometimes even put my feet up, or just put them on in the morning before my flight and left. The most important thing here actually is that you need to put on the socks and compression stockings when you've just woken up but haven't walked around yet. Putting on the socks after walking all day won't help much. All your veins are already filled with blood, you'll just squeeze them and basically the blood won't circulate anywhere anymore. How do these stockings work and help? The veins are empty and compressed, so no blood fills them. When sitting on the plane, they're compressed and lack blood. The risk of a clot forming there is very low. That's why when there's a risk factor like during a flight or before surgery, the first thing we do when bandaging legs is use compression stockings. Especially if you have a risk factor like varicose veins in your legs, then you definitely need to watch out for this and monitor it. Because another risk factor is varicose veins in the lower limbs. The valve system doesn't work well, so blood can't leave the legs properly, increasing all risks. If you are taking oral contraceptives, then probably it would be logical before the flight, and actually I don't even take them myself because men don't take them. I use low molecular weight heparin if the flight is over 6-7 hours. It's recommended to inject low molecular weight heparin the night or morning before the flight. These include Clexane, Fragmin, and others like Fluxum 0.4, 0.6. This will significantly reduce your risk of thrombosis. That is, this medication also prevents platelets from sticking together. This was commonly used in clinics as a preventive measure during surgeries. Water, whether you're flying or just living day to day, never let yourself get dehydrated. Where blood stops circulating properly, where the periphery is in spasm, where blood rheology is poor, there is always a high risk of thrombosis. So, if you don't drink enough water and don't move much, your risk of thrombosis will also be higher. We'll use an airplane as our example for analysis. That's why on a plane, it's advised to wear compression stockings and get up regularly, even if you don't need the restroom. You've seen smart people walking around the plane. They're not foolish. Stand up, walk, and do some squats, especially on long flights. So please don't be shy. It's your health, it's your longevity. Thrombus complications, especially thromboembolism, pose extremely serious risks. Don't be afraid to look silly. Stand, walk around, walk in your stockings, do squats, and stay hydrated. Stay hydrated. Notice how airlines always offer drinks? Here's why. Because everyone starts losing fluids from their system. This is especially important for those who drink alcohol before a flight. I strongly advise against doing that as well, especially before long extended flights. No alcohol on board, no alcohol before the flight. Of course, you asked me an interesting question about blood clots and lying down. Is the risk of thrombosis lower if you are in a horizontal position? Of course, it's lower since blood flows more easily. That's exactly why, if possible, not for everyone of course, but if a person has the opportunity to put their legs on the neighboring seat and fly sitting like that. If there's no one next to you, take a seat and sit for a while. It's actually comfortable, just like business class. Why do all business or premium classes, first class, allow you to raise your legs and lie down horizontally? Because that also reduces your fatigue and improves your heart's ability to pump adequate blood. And by the way, try not to eat too many sweets before or during flights. That's also a very important point. Increased consumption of fast carbohydrates, specifically glucose, worsens blood rheology, and the ability of cells to stick together becomes higher. That's why you should try to eat as clean as possible on the day of your flight, especially if you smoke, if you're on contraceptives, or if you have varicose veins in your lower limbs. 9-hour flight. If you just recovered from coronavirus, maybe take the train instead. This is very important, and I really hope you'll listen to me. Many of you are probably wondering, what about other types of blood clots? Why are we only talking about blood clots in the legs? Well, we focused on them because they are something that can take a person's life. Look at how many athletes have died this year. Look at how many athletes died last year among professional Olympians. Why? Dehydration? Changes in venous tone. Look at how much their large veins have changed. Nick Walker, an Olympia debutant last year, is competing again. Just look at how bad his legs are. Honestly, my biggest worry is that he could get a blood clot and die during his prep. If you get a thrombosis, what should you do? If it's something critical, really scary, something big. Unfortunately, if you're not a professional, there's not much you can do except perform cardiopulmonary resuscitation if the person has lost consciousness. If there's a professional nearby, of course, the chances are higher. But again, if the clot is large, the chances that you'll be able to do something at home or without a specialist's help are very small. If someone develops thrombosis with smaller clots that don't cause major issues, symptoms may be mild, such as a cough, sometimes even resembling pneumonia or pneumonitis on an X-ray. And sometimes there's also fever. An increase in temperature is also one of the signs. So how can you even suspect the presence of a thrombus? How can you determine it? The simplest way is ultrasound. Ultrasound of the lower limbs, in the abdomen, in the arms. You don't need to look for thrombi, as they rarely cause serious issues. They're usually in the legs. So if you have, as we said, hyperemia, localized swelling, pain in your leg, reasons for these symptoms to appear, then please get an ultrasound. If we detect it early, we can act. So what should we do? Compression garments, the use of medications that thin the blood, such as low molecular weight heparins in the form of injections, and over time the clot dissolves. If the clot is floating, meaning it's on the verge of breaking off and is poorly attached, which can be seen on ultrasound, then special filters are placed for such patients into the inferior vena cava. A mesh filter is placed to catch clots if they break off, protects you from... The clot could kill you. Even if it breaks off or with repeated thrombosis, this filter remains for life. And on the one hand, you don't have to be afraid of the risk of thromboembolism. But of course, it's better not to let things get to the point where you need to have this filter placed. From laboratory diagnostics, especially if you are planning a pregnancy, I would recommend a genetic profile test for thrombophilia. These are hereditary disorders that can lead to a higher risk of thrombosis. Especially during pregnancy, this can become a problem and carrying the fetus will be at greater risk. For such patients, low molecular weight heparin is prescribed again until delivery based on blood test results. Sometimes this isn't visible. Maybe you can detect thrombosis, that's the D-dimer. D-dimer increases not only with thrombosis, but if it's significantly elevated, that will also be a reason to think that maybe there's something somewhere. Athletes who use testosterone or people who are on hormone replacement therapy underestimate the risks the most. That's why we'll definitely make a separate, good, interesting video about this. Subscribe, hit the bell, and you'll be the first to know about it. How can you even tell if you have a tendency? Genetic tests aren't part of a checkup, so you don't need to take them right away. However, I recommend doing them occasionally. This is crucial if you're taking a long flight. This is a coagulation test, also known as a hemostasiogram. These are a series of indicators that, when taken together, will help you understand how high or low your risk of blood clot formation is at the moment of the body. My friends, subscribe to my Telegram channel. If you have any interview suggestions, write to me there. I read your messages, sometimes answer your questions, and post a lot of interesting clinical cases and examples.